What's the difference between pelvic floor and pelvic diaphragm? That's the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, so stay tuned. All right, so what is the difference between pelvic floor and pelvic diaphragm? So unlike what most people realize, we have more than one diaphragm. So you've got an abdominal diaphragm, but right above your pubic bone is the region where the pelvic diaphragm resides. So the movement of pressure from abdominal diaphragm to pelvic diaphragm is what moves all of your internal organs with every breath. It moves all the internal organs down towards the pelvic diaphragm and then pushes the diaphragm into what's referred to as the pelvic inlet. So right here in this pelvis, right where my left hand is, this hand is where your pelvic floor would be. Inside the lining, all of this would have the pelvic floor muscles. And then the pelvic diaphragm is about here. So as you breathe from the rib cage and the pressure goes down to the pelvic diaphragm is pushed down into this hole of the pelvis, and then when it can only go so far, then it stops and the whole breathing out process takes place and that surface goes up. So pelvic diaphragm is right above the pelvic floor muscle area. Do they go hand in hand? Absolutely. So when we're working on the inside of you through anus or vagina, as the therapy is being done in that area, what the breathing allows us to go with, to feel how that diaphragm is functioning. And just like every exercise you do, you know that you breathe in, you breathe out, and you do different things. So that's encouraged with yoga, that's encouraged with even weightlifting. So you got to keep that in mind when the therapist is inside and it's coordinating, asking you to do the breath. We're feeling the diaphragm engaging, and then coordinate that with the relaxation of those muscles, and then later on being able to do kegels. So I just wanted to clarify those two terminologies because a lot of times people mix the two. They're not the same, but they're very much related. At any rate, if you have any questions, contact one of the methods in the description box. Make sure you subscribe to the channel, and until next time, take care.